Hello guys, hi. I hope you're well. So, most of you mmekuwa mnaniuliza questions about your hormone imbalance, and I thought maybe I should do a video alafu niwapostie. So, kuna watu wengi wako na hormone imbalance na hawajui kwamba wako na hormone imbalance. So, hormone imbalance ina affect both genders, both men and women. So, make sure you watch the full video. Nitapost hapa kidogo, halafu video ingine yote nitapost kwa YouTube. Kisha unaenda kwa YouTube yangu, una check hapa hivi Dr. Pasi Health Connect, then you watch, you like, you comment and you subscribe. So what is hormone imbalance? Hormone imbalance is basically too much or too little of a hormone in the body. Hormone imbalance, this occurs where there is too much or too little of one or more hormones in the bloodstream. Hormones, they act as chemical messengers that regulate most body processes. I'm going to focus on reproductive hormones as a cause of hormone imbalance. So, as we all know, ladies have two major hormones. The most common hormones that we have the estrogen and progesterone. One person may have hormone imbalance due to either deficiency of the two hormones, or one hormone may be in excess or one hormone may be less. We also have hormones such as luteinizing hormone. When you have hormone in reproductive hormones, the simplest sign of having hormone imbalance is having difficulty in conceiving, which we usually call it as infertility or impotence in men. Then we also have irregular cycles. Then we can also have menstruation cycles that are not normal. Some may not come regularly, some may come irregularly, some may be very painful, others may experience cramping with no bleeding. All those are signs of hormone imbalance. Someone will ask you, what causes hormone imbalance? So basically, hormone imbalance will be caused by definitely things like genetics. You may find some people naturally may have a particular hormone that is excess, such as a female having male hormones that are in excess. So that's genetics. That's the simplest form of hormone imbalance. Then we also have stress. Hormone imbalance can be caused by stress. How? When somebody is stressed, your body will react. So your body, when it reacts, it produces a hormone called cortisol. This is a stress hormone. So it comes to counter the effects. Under the symptoms of hormone imbalance, we may have unexplained weight gain. Then we can have fatigue. We can have mood swings, skin problems, hair changes. That is a symptom of hormone imbalance. We have fatigue and sleep problems, mood swings, skin problems like persistent acne or dry skin changes, including hair loss or excessive hair growth. So for example, you are a lady and you are growing beards, that's a sign of hormone imbalance. We have changes in heart rate. Then we have increased thirst and frequent urination. And then we have digestive issues, changes in sex drive. So these are the common symptoms. Then we go to gender specific symptoms. So in females, one symptom is usually irregular periods, hot flashes, night sweats, vaginal dryness, and infertility. Also, we may have the period or menstrual problems. In males, we may have erectile dysfunction, loss of muscle mass, decreased body hair growth, such as the beards, and enlarged breast tissue. We have gynecomastia. Hormone levels, they naturally fluctuate during life stages. Like hormone levels naturally fluctuate during life stages like puberty, pregnancy, and menopause. However, significant or chronic imbalance can be caused by various factors including medical conditions such as thyroid disorder. Under thyroid disorders, we have hyperthyroidism and hypothyroidism. Then we have polycystic ovary syndrome, the PCOS. Then we have diabetes. We also have Cushing's syndrome and the Addison's disease. So these are the medical conditions that may make one to have hormonal imbalance. We can have growth. Under growth, we can have tumors, cysts, or other growths on endocrine glands, pituitary, adrenal, thyroid, ovaries, testes. They can also disrupt hormone production. Then we have lifestyle disorders such as chronic stress, which raises the cortisol levels. We have poor diet. If you're not eating a balanced diet, you may have hormone imbalance. Then being overweight or obese and lack of quality sleep. This may make you to have hormone imbalance. Under medications, which is a major cause of hormone imbalance, we can have certain medications including hormone therapy or birth control pills that can affect the hormone levels. Lastly, we have environmental factors, exposure to toxins and endocrine disrupting chemicals like pesticides. This may make somebody to have hormonal imbalance. Now we go to the diagnosis and treatment. So if you experience new or persistent symptoms, it's important to consult a professional such as a primary care provider. These are people, medics who are around you, or a specialist, usually an endocrinologist. This is a specialist in hormone conditions. Okay, the diagnosis of hormone imbalance usually entails in reviewing your health history and symptoms. A physical exam such as tests can be done on your body to confirm which hormone is deficient or in excess. So we have blood tests. Under blood tests, you can do a hormone profile to measure the levels of specific hormones such as estrogen, testosterone, thyroid hormones, cortisol, and insulin. We have imaging results, imaging tests such as ultrasounds or MRIs to check for cysts, tumors, or damage to the endocrine glands. Then we have urine tests to measure hormone levels over a period of time. For example, the simple urine test is a hormonal test, which usually go to the chemist and buy a test for pregnancy. That's a hormonal test. Now, lastly, we go to the treatment, and treatment depends on entirely the cause. So, medications such as hormone replacement therapy (HRT), thyroid medications such as levothyroxine for hypothyroidism, anti-androgens and anti-androgen drugs. This one will correct conditions such as hypothyroidism and hyperthyroidism. So that one will work on the thyroid problems. Lifestyle changes, including we have lifestyle changes including a balanced diet, regular exercise, stress management techniques like yoga and meditation. Then you also have consistent and high quality sleep. So make sure you sleep enough and in a good position. Then we can have surgery and other medical procedures. If the imbalance is caused by a tumor or a structural tissue, a surgery can be done to correct the problem. Okay, so basically maintaining a healthy lifestyle can help support overall hormonal health, although many imbalances are not preventable. So in case you have a problem with your hormones, I've said you go and see an endocrinologist. Okay, so thank you. Make sure you like this video, make sure you have subscribed. Yeah, thank you, and you share to your friends whom you feel like they have these problems. Thank you.